It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, we're continuing on with our health information on the Lehigh Valley Health Network. I'm telling you, folks, it just gets better and better and better. Today, folks, we got an exciting show for you. The oncology services that Lehigh Valley Health Network has to offer. Once again, you're going to hear some exciting things. On the show today, I have the director of the cancer program. His name is Suresh, Nair, and he comes from the Lehigh Valley Hospital, Cedar, Crest. And of course, we had Dr. Michael Evans and Dr. Hotchner on before. They're here again to give us some more information on what's going on now. Throughout the show, sometimes, you'd like to get more information or specifics. I'm going to put a phone number, or the phone number is 570-501-1242. There's a reason why I'm giving you the number now, folks, because you're going to want to probably get some information on what we're going to be talking about today. Dr. Nair, how are you?
Very good, Sam.
Good.
Thank you.
Suresh Nair.
Yes.
Pakistani?
No, it's an Indian name.
Indian. Oh,
yep.
Sorry about that.
That's okay.
A good friend of mine, Dr. Kathio, is a Pakistani veterinarian.
Yeah.
So tell me a little bit about yourself, doctor.
Sure. My parents came to the U.S. in the early 70s. My father is a chemist. I grew up in York, Pennsylvania, and I went to Penn State undergrad, then Jefferson for medical school, and did residency in Central PA at Geisinger, and then decided to go into oncology as a profession, and went to University of Pittsburgh, and then it first came back on staff at Geisinger. I was in Danville from 90 to 2004, did a lot of research in cancer with the Mayo Clinic, and then in 2004 I had an opportunity to go to Lehigh Valley Hospital and be head of cancer research there, and also have a practice. And I've been there 11 years. It's been a wonderful adventure.
So let me ask you, it's interesting because, everyone chooses a profession, okay? Were you born in India?
I was born in India.
Okay.
I was 11 when my father had a chance to come to this great country.
Why did you decide to go into oncology?
When I went to college, I liked maths and sciences, and I was very fortunate. My father really had very little money saved for college, and Penn State and Jefferson had an accelerated medical program where you could get everything in 6 years. And I was a people person. I thought I liked the service part of medicine. Also liked research, and so I think the chance to save 2 years of college and go through the Penn State Jefferson program played a role. I think along the way I had a lot of mentors.
And so you decided to go in oncology.
Mm-hmm.
How long have you been a doctor?
26 years.
And how long have you been involved with cancer research?
26. I mean, before that I did 6 years of training before the 26 years.
Now I'm going to ask you a dumb question, okay? Because have you seen, I know this is a dumb question, have you seen a lot of progress in the years in cancer, curing of cancer, or sustaining life?
There's no doubt, Sam, because when I came out of Pittsburgh in 1990, most of the common stage 4 cancers, we had a hard time getting people to live beyond a year, and it was hard to tell that our chemotherapies were really helping improve quality of life or quantity of life. It's day and night now. The pace of progress, I would say especially the last 5 years, as we're learning more about the mutations in the cancer, the individual nature. Every colon cancer is different based on the genes that are in the cancer, based on our own inheritance, our own genetics. And so the science is getting to such a high level. And now the latest breakthroughs have been in immune treatments. We're finding ways that cancer weakens our immune system, and we're finding natural ways to boost our immune system so our own T cells can reject cancer.
Okay. Now, we often hear about stages, okay? I know my mother had cancer, and she had both her breast off, and then she had uterine cancer, and thank God she survived, and she got them at 80 and until 90 years old. What are the different stages, and what does it mean? Because someone says, "Oh, you have stage 4, you're dead." Stage 5, I have no idea.
Right.
Okay.
So the cancer is stage from 1 through 4. Stage 1 is when it's localized to an organ, and most of the time surgery is the treatment for stage 1, and the cure rates are high. Stage 4 is when it's spread to distant organs. Some stage 4 cancers are highly curable. You know, for instance, everybody knows about Lance Armstrong, and his was testicular cancer spread to the brain, which was stage 4, but still curable. Some cancers are not curable with stage 4, but we have treatments that can significantly extend life. People can live with stage 4 cancer sometimes 5-10 years. So it's not the way it used to be. People used to think once you had a stage 4 diagnosis, you know, you're a goner, and that's not the case anymore. And stage 2 and 3 are in between. Often they're spread to lymph nodes. It's the extent of spread, you know, and there may be microscopic cells beyond the lymph nodes and organs that you can't see yet when it's stage 2.
Is that why they prescribe chemo?
Yes.
Has chemo changed throughout the years? Because people say, "Oh, chemo, oh my God, I get sick." But you know, is there
chemo? The supportive care of chemotherapies come a long, long way. So the anti-nausea medicines that we have, just being able to get people through the treatments in a safer, easier way has improved. The other thing that's happened is over the last 10 years, majority of the new cancer treatments that have come out have not been chemotherapy, but have been targeted medicines. They're targeting a specific mutation in a cancer. And these are almost regular pills that you take, you know, often not that different from pills you take for diabetes. And so some of the major advances have happened with these targeted medicines.
All right, so there's sometimes a word that you never want to hear when you go to the doctor is you have cancer. That's the bad news. The good news is that we have an opportunity of getting there and curing it, okay? What's the most common form of cancer?
Lung cancer is still very common, breast cancer, colon cancer, prostate cancer, those are probably the 4 most common.
Mm-hmm. So how does one, I guess the mammograms for breast?
Yes.
Lung, what do you do for that? I mean,
yeah, there is now a new way to catch lung cancer early. So people with a significant smoking history, there's a low-dose CAT scan that can be done. It can be done at low cost and as a screening test, almost a yearly screening test to help find lung cancer early.
Do you find that lung cancer, the percentage is higher with smokers?
Yes.
Okay, so anyone who is a smoker who quit smoking, I would highly advise them to get this CAT scan. You said it's a low dose?
Yeah, and yes, and Lehigh Valley has a special program where we're offering low-cost screening.
That's a must.
Yeah.
Well, you know, it's a lot of things preventable, like colonoscopy.
Yes.
I mean, you know, it took me 4 years before, you know, to go and get a colonoscopy because I'm a big baby when it comes to, I'm the biggest baby going, okay? So finally, Dr. Umula said, look, so I went up there, it was a piece of cake. I mean, just piece of cake, nothing to it, okay? And just the peace of mind of knowing, and if there is something there, you know it could be addressed. How many cancers can be prevented if someone would just go and get a CAT scan, like you said, for lung or for a colon, et cetera, breast, et cetera. So prevention is really a big key here.
It is.
Yeah. So now you're with Lehigh Valley, okay? Fabulous health network, you know. We're so lucky, really, in this area to have the health care. Now something really exciting is happening. Okay, and I think it's not only a home run, it's a grand slam. It's exciting, to say the least, but this working with Sloan Kettering, okay, probably one of the top cancer hospitals in the world, okay. Tell me how this thing evolved. How did it happen?
So over the last 10 years, Lehigh Valley became more and more prominent across the country as one of the top community cancer center programs. And about 4 years ago, we were fortunate to be picked by the National Cancer Institute as one of their 21 NCI-funded sites to increase clinical trials. So clinical trials are new treatments that are hoping to improve on the results. And we did very well through this program. And big centers like Sloan Kettering started to take notice. And about 2 years ago, Sloan Kettering decided for over 100 years, they've been in the New York metropolitan area, and they clearly have the best outcomes, the largest number of research trials. They have about 900 clinical trials. Lehigh Valley, for instance, has 100 clinical trials. And the other thing that happened is that there's been an explosion of new treatments, new knowledge. And Sloan Kettering's leaders came to a very important conclusion that they needed to work with the community physicians where 80%, 85% of cancer care is delivered, to get the technology out there, to get the research, get the standards of care out there. But Sloan was very protective of their brand. They have the top brand equity. So they were very careful. And so they decided to take a couple of years and really research the whole country and pick partners. They're planning only up to 6-8 partners over the next few years. And last year they announced Hartford Healthcare in Connecticut as their first partner. About 4 weeks ago they announced us as their second partner. And we're delighted. They're only planning about 3 or so partnerships in the eastern half of the US. And for us to be selected is really good news for all of Pennsylvania, especially the eastern and central Pennsylvania.
You know, Suresh, I see this as a two-way street because, you know, a person told me many years ago, nobody has a monopoly on ideas. Okay, and when you have experts, you don't know, it could be a small town doctor who is doing research and comes up with something. And here you have Sloan Kettering, and you have the geniuses there. You have the geniuses in your oncology department. We're going to be talking to them. And I think this is, you know, because everyone shares this information. Am I correct?
That's exactly it. And Dr. Bazelga, who's the physician-in-chief of Sloan, he's a very humble man. He came from Barcelona. He's done a lot of work at Sloan. He's one of the visionaries in breast cancer research. And he made the exact same comment that you did, Sam, that sometimes it's that small observation that can fuel a new cure. And they're calling this, that we're learning from them, they're learning from us. They're also learning from analyzing the tumors of our patients. Right now, Sloan Kettering gets to look at about 14,000 new cancer cases from the New York area. Through this partnership, they eventually want to be able to study 50,000 cancers in detail and look at, really profile the genes and look at and use our patients with their permission as a way to find new cures.
You know, I could share, I'm sure everyone has personal stories, but you talk about the genius that we have with Sloan Kettering. A good friend of mine many years ago was told that he had to have an operation, okay, that would be cutting him from here to here, and he would lose his muscles, his mouth would be dry, etc. He was devastated. Okay, so my wife, who is a registered nurse, says, well, look, before they do anything, let's go to, this is years ago, okay, let's go to Sloan Kettering, okay. Driving down there, I'm thinking the worst, they're going to admit him, they're doing this, etc. Goes in there, this doctor does the examination, looks at x-rays and says, you don't have anything here, okay. But they didn't have the actual specimen itself. They had, so in order to play it safe, they prescribed radiation, okay. And thank God ever since then. I said, so you know how excited I feel as an individual and in the media to be able to have, you know, Lehigh Valley Network Hospital working with Sloan Kettering. And not only that, but we just had John Fletcher on and Dr. Vlent talking about everything else is great about Lehigh Valley Health Network. It must be really exciting to be involved with that, huh?
It's very exciting. As someone who's lived in central Pennsylvania, eastern Pennsylvania for over 40 some years, for us, for our population, whether it's Hazleton, Allentown, to have access to the best cancer care in the world, and cancer treatments can tie up a lot of time. Yes. And people have to work, they have to keep their insurance, take care of their families. And so the ability to, you know, for patients to see Mike Evans, you know, Harvey Hotchner right here in Hazleton, and for us to, through Lehigh Valley Network, bring the latest treatments from New York right here to their doorsteps and keep them occupied and living life. That's what it's all about.
See, folks, that's why I told you to write the phone number down, okay? And I know a lot of you out there may be concerned. Well, I'm not going to say don't worry, but I'm going to say you have worries or less, because it's 570-501-1242. You have this great knowledge available right now in our own backyard, which is phenomenal. We'll be back right after this message. Welcome back to the Sam Lesante Show, folks. Remember, 247ssptv.com. All of our health shows are there. Also, you go to Lehigh Valley Health Network website and get any information you want. We're talking about the oncology services that are available at Lehigh Valley Hospital. There's a career center now, or a cancer center, a new cancer center that's opening, and clinical trials here in the greater Hazleton area. And joining me on my show today is Dr. Michael Evans, Dr. Harvey Hotchner, and of course, Suresh Nair, Dr. Suresh Nair, who is director of the cancer program. So, well, let me welcome Harvey back and Michael back. Nice to. It's part 2 of our show, you know. We could go on the road with this, you understand?
We're keeping track. Huh?
Yeah, keep it track. Okay, so Dr. Hotchner, tell us a little bit about the exciting news about the new career center here in Hazleton.
Yeah, we'll have a comprehensive cancer center where we can do diagnosis and treatments. We have full-time RNs that will administer chemotherapy based on our diagnosis. We can see anything from anemias to blood disorders to clotting disorders to any form of cancers or tumors for diagnosis and treatment.
So now, the services you provide will be what then?
Well, it'll be a full service. We'll be able to diagnose and treat. So we can see blood disorders, which include anemias, clotting disorders. People clot too much, people clot too little. Anemias, any type of cancers for treatment and diagnosis and treatment.
All right, so now if someone's getting a colostomy, okay, and they discover a polyp, right? Mm-hmm. And it's cancerous, right? So then, is that where you guys take over then?
Well, usually we'll see the patient after the surgery, and after the pathology and the staging is done.
Okay.
And we decide if patient depends on the stage of their early stage cancer, of a colon cancer. If they're what we call stage 3, which means their lymph nodes are involved, then they need what we call adjuvant treatment, which is adding to the surgery. And people have more advanced disease, like with spread to an organ, stage 4, then we would treat them more continuously.
So now with this cooperating with Sloan Kettering, as the Dr. Nair said, you have access, of course, correct me if I'm wrong, you have access to all of those opportunities that with Sloan Kettering.
So what that would open doors for is if somebody we already treated somebody and the treatments are no longer working, hopefully there's more experimental, a new treatment being studied that will work. Hopefully there'll be studies what we call preventive trials for people who need either adjuvant treatment or somebody has more advanced disease that we don't have anything that we think will work any longer.
Mm-hmm. How long have you been a doctor?
About 25 years.
So you have a little experience.
Yeah.
Yeah, 25 years. Now we're going to come to the kid, you know. I can't believe you look like you're 18 years old, God bless you. Stay that way. See, people think like I'm 50, I'm really 39. No comments over that. Dr. Michael Evans, nice to have you back on the show. How do you think this cancer center is going to enhance, it's a stupid question, but give me an answer, enhance the services for people of northeastern Pennsylvania?
Well, I think, since I've been here, which is shortly after the affiliation with Lehigh Valley Hospital, things have been changing, really at leaps and bounds. The first time I was on your show, I think back in January, it was just me. And at this point, we're growing and growing. We're about to open up the new cancer center building. And, everything with the affiliation with Lehigh Valley in Allentown, then also with Sloan Kettering just means there's more ideas, that more minds coming together to help plan treatment. And that can be anything from a clinical trial to a second opinion. A lot of people like to get second opinions, especially with a cancer diagnosis. And you could imagine a patient coming to see me and then potentially going to see somebody at Sloan Kettering. And if they're eligible for a clinical trial and interested, they would be able to receive the treatment here.
They're there.
And so hopefully that's where we're going.
Talk about second opinion. You get second, third, fourth, fifth, sixth, you get hundreds of opinions. Exactly. It's amazing.
And I think that's the way to go, really. Especially, you know, you want to maximize outcomes, positive outcomes, and you know, to have back and forth with a doctor who really is focused in on one particular type of cancer, like they have at Sloan Kettering, is sometimes very helpful.
Okay, so what's a tumor board? A tumor board?
Tumor board is, you know, that again is usually focused on a particular organ, and it's where you have a meeting generally once a week to review cases that fit into that category. And so you'll have the surgeons there, you'll have the radiologist there, you'll have the pathologist there, you'll have the radiation oncologist there, and then you'll have the medical oncologist there. And each case is reviewed thoroughly, and you know, basically then a treatment plan is contemplated, or if there's any more diagnostic studies that need to be done, that's discussed as well. And so currently we participate remotely with the tumor boards that are going on in Allentown, and you know, that's certainly very helpful in terms of getting our cases reviewed by a larger number of specialists.
Is there a formula that you'll be using when someone comes in with a specific type of cancer or whatever? Will there be, when I say formula, will it be like, okay, I do this, then I contact Suresh, and then they contact Sloan, or how will that work?
You know, in terms of utilizing all of our resources, I think you know, that's already underway. I think tumor board is a focal point there. You know, if the case is reviewed in tumor board, then it's generally going to be seen by the specialists in Allentown, as well as by Dr. Hotchner and I here in Hazleton. And you know, there generally is an algorithm. There's guidelines and algorithms that help dictate what treatment should be. And you know, a lot of the time you're moving down the algorithm and you get to a place where it says clinical trial versus some other form of treatment, and that's where the affiliation is really going to be helpful.
The reason why I ask you that is, okay, so we have Sloan, we have Lehigh, and we have Hazleton. Someone would think, well, geez, do they really have that much going from in Hazleton versus me going to the Sloan, you know, the big boys in Sloan or the big boys in Lehigh Valley, etc. So what I'm saying is, you could feel, I'm not putting words in your mouth, but correct me, you could feel comfortable that you're getting the full array of, you know, cancer experts, you know, when you're coming to the Hazleton Center. Am I correct, Dr. Hotchner?
Yeah, I mean, we follow guidelines, and then if we have any questions, we pick up the phone and we can talk to a doctor down in Lehigh Valley and say, if you have somebody who specializes down there, have people specialize like in lung cancer, in colon cancer. So if somebody has lung cancer and you want to get another opinion, you can call one of the doctors down there and talk to them and say, is this a good plan, or do you want to see the patient, or do you have anything experimental that this patient would be a candidate for? So, I mean, there's a lot of verbal communications that we do behind the scenes that, you know, sometimes you can save a patient a trip.
Can I say with certainty that, would it be like me going to getting advice from Sloan Kettering when I come to the Hazleton Oncology services?
Well, at least an opinion from Lehigh Valley at this point.
Yeah.
Because we don't know exactly, you know, what our relation, you know, total relationship will be.
Suresh?
Yes, I can talk about that. The Sloan has what they call standards of care when you talked about the formula.
Yeah.
So for every cancer, different stage, they've come up with what they think is the best standard of care as of right now. And these standards are changing week by week. So what we're doing the next 4 months, we're already deep into this process, is comparing our standards of care at Lehigh Valley, which extends to Hazleton, because we have the same standard of care at Hazleton, at Allentown, at Bethlehem. And Sloan is actually giving us a report card. And part of my job as the director of the cancer program is doing any remediation, if there's some things that we could be doing better. And there are some little things. We got our first report card on medical oncology and came back, we got a very high score. We were highly aligned. But there were certain things that they recommended, such as our surgeons discussing cases in a tumor board on a weekly basis before they do the first surgery, to do that across the board rather than on specific cases. So there's some things that Sloan does because of the volume that they do, and as Mike said, they're so super specialized. I was in New York last Wednesday with 3 of my colleagues, meeting with the heads of oncology there. And just in medical oncology, they have 350 physicians. We have 16 at, in the Lehigh Valley. We have two here.
So folks, if you're having any concerns right now, 570, call them, 570-501-1242, just for information, which is so critical. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. The oncology services are just unbelievable now that with the affiliation with Sloan Kettering. But Dr. Evans, this new cancer center and clinical trials center that you'll be, when are there open houses? People get information on that?
Yeah, it's currently just wrapping up construction, and we hope to have the open house October 1st from 4 to 6 o'clock. And it'll be open to the community to come by, check it out. It's brand new. I think it's very well staffed, and you'll get to meet some of the staff at that occasion as well.
Well, I know one thing. I think it's, I applaud really Lehigh Valley Hospital. We've been, as Dr. John Fletcher said, you know, was a great opportunity for us, and we see the healthcare just going to the roof. And pleasure meeting you, Suresh. I'm sure we're going to be doing a lot more because, as I said, this is gold for northeastern Pennsylvania that we have here. Okay, it just like soars right to the top. My guest today, folks, from Lehigh Valley Healthcare Network, Dr. Michael Evans, who oncologist, who's here in Hazleton, Dr. Harvey Hotchner, who is here in Hazleton, and Dr. Suresh Nair. He is the Cancer Program Director for Lehigh Valley Hospital, Cedar, Crest. Once again, 570-501, I want to get it right, 1242 for any information, particularly for those of you who may have cancer now or whatever. Get the information. We'll see you next time.